Hello, everybody. My name is Claire Strobel. I'm a rising senior at Central Bucks High School South in a suburb of Philadelphia, Pennsylvania. And my mentor was Lizanne McDonald, who is a clinical coordinator and lecturer at the Cape Peninsula University of Technology in South Africa. And our research topic was on an analysis of healthcare inequities affecting members of the LGBT community. And you can hit next. And so first, I want to talk about why I chose this topic. When I applied to Talaria, I initially put my research interest as something to do with mathematics and computer science. But I also mentioned that I was a bisexual woman in my application, which may have influenced the decision to pair me with a mentor who is interested in the social sciences and LGBT specific topics. And since she was a clinical coordinator, that I suggested the idea of healthcare because that suits her area of expertise. And so I decided to see how those two topics intersect with how the LGBT community has experiences inequities in relation to healthcare, because it is a topic that I'm interested in and it has personal significance to me and my identity. And the methods I use to conduct this, I mostly use Google Scholar to select the papers that I used because I mainly wanted to do a literature review. And I was able to use keywords such as LGBT, transgender, healthcare outcomes, inequities, etc. And I also, besides the scholarly papers I used, I also was able to look in non-scholarly news articles that discuss LGBT issues and look for the scholarly sources that they referenced, and added those to my search. And I tried to limit my search to the past 15 years because the topic of LGBTQ issues are a topic that is frequently being updated, and I'm sorry, I can't find the word, but that it's a very recent topic. And the goal of my research was to add a more intersectional view to the issues of LGBT healthcare inequities, because many of the papers I studied for my literature review only focused on one aspect or like one disease that LGBTQ people were affected by, or one cause of why they're affected by it. But it's a very multifaceted issue with a lot of different causes and effects. And I wanted to combine all of the papers I did to make a more comprehensive view of the issues with LGBT people in healthcare. And you can hit next. So those who identify as LGBT, I found throughout my research that those who identify as LGBT are affected by many major illnesses and diseases that at rates that are significantly higher than that of their non-LGBT counterparts. And you can hit next. So it should be established that only 5.6% of US adults identify as LGBT. And like I said earlier, this is a number that is rapidly rising, which is why LGBT issues should be frequently studied and updated. And it is, as of 2020, it is very, the majority of people who identify as LGBT are Gen Z, which is important because many of the studies I referenced in my paper discussed LGBT youth in the statistics, which mainly constitutes Gen Z. And you can hit next. And although LGBT people only make up 5.6% of the population, they are affected. They are very disproportionately affected by many diseases such as HIV. And in 2019, 6% of new HIV diagnoses were among gay and bisexual men. And you can hit next. Additionally, LGBT people are affected disproportionately by many other issues such as substance abuse, smoking, cancer, and other sexually transmitted infections. And you can hit next. And this issue does not only extend to physical illnesses, but to mental illnesses, as well. As you can see in this infographic, LGBTQ children and teens, that's the Gen Z that I referenced earlier, are 4 times more likely to attempt suicide than heterosexual people, which goes hand in hand with mental health issues. And you can hit next. And so the potential causes of this are, first of all, maltreatment in healthcare. You can hit next. And as you can see in this graph, larger shares of LGBT adults report negative experiences with their healthcare providers compared with non-LGBT adults. LGBT adults are more likely to report that their healthcare provider didn't believe they were telling the truth, that their healthcare provider assumed something about them without asking, and that the healthcare provider dismissed some of their concerns. This may be because many healthcare professionals have outdated views of the LGBT community, and also because there is a lack of education in the medical field about LGBT issues, which can translate into I'm sorry,
You're doing great, don't worry.
I'm so sorry. I just got a text from my mom. I guess she doesn't know.
Yep.
Oh my God, I'm so sorry. Okay, I'm really sorry. I'm really sorry about that.
No, don't worry. Okay, you're doing great.
You can hit next. So, as well as the maltreatment, LGBT people often face stigma from not only professionals but their peers as well. As you can see, LGBTQ youth are very likely to experience bullying, whether it is electronic or in person. And this is especially high amongst transgender and non-binary youth. And this goes hand in hand with the suicide rates that I discussed earlier, because people who are bullied are more likely to attempt suicide, and that applies to LGBT people. And you can hit next. And so there are many socioeconomic barriers that face LGBT people specifically. As you can see from this graph, LGBT people are more likely to lack healthcare insurance than non-LGBT people, which can make healthcare less affordable. And especially in the US, as healthcare premiums are so high, this can translate into not being able to access the care that they need. And you can hit next. And so it is important to discuss intersectionality when we're talking about LGBT issues, because LGBT people who are assigned female at birth often face medical misogyny as well, which can make them more likely to, which can make them which can translate into the levels of care that they receive, and so that they are often they often have even less positive healthcare experiences than LGBT men do. And you can hit next. So as you can see, while the rates between LGBT and non-LGBT men for percentage of people in the US who do not have a personal doctor is insignificant, the difference between LGBT and non-LGBT women is 13 percentage points, which translates to higher difference between LGBT and non-LGBT adults as a whole. And you can hit next. And lesbian and bisexual women, as well as transgender men, are less likely to have received gynecological care, such as mammograms and pap smears, than their heterosexual women counterparts are, which can again be attributed to stigma, maltreatment, and socioeconomic barriers. And you can hit next. And as I discussed earlier, of gay and bisexual men who receive gay and bisexual men are disproportionately likely to receive an HIV diagnosis, and of these, the majority are Black or African American or Hispanic or Latino, and it is important to consider because even though they make up a smaller percentage of the population, they are disproportionately represented. And this could be due to the factors I mentioned earlier, that Black LGBT people, especially Black transgender people, are more likely to be at a lower socioeconomic status and more likely to experience discrimination. And you can hit next. And of the percentage of LGBTQ youth that reported a past year suicide attempt, the highest percentage came from American Indian and Alaska Native youth, which can again be attributed to those factors. And you can hit next. I guess hit next again. And then the solution to this is one, greater awareness of LGBT issues. And this starts like in schools to prevent, and this starts in schools to prevent bullying and to prevent bullying and to I'm really sorry.
No, it's okay. Don't worry.
I just got because and more comprehensive healthcare education, as I discussed earlier. The nurses and doctors may have biases towards LGBT people, which can be mitigated by the more a curriculum that emphasizes LGBT issues and educates medical practitioners on those issues. And advancements in treatment technology are also important because, like I said, the LGBT movement is very modern and it needs to be frequently updated. And with the rise of the digital age, there are many solutions that can help mitigate the disparities that LGBT people faced. One solution I encountered was the adaptation of electronic health records. And this helps transgender people because in these electronic records, they can input their preferred name to prevent them from being dead named, which means referred to their name at birth. But being dead named corresponds to higher rates of depression and suicidal ideation. This can greatly help to reduce that. And you can hit next. And it is also important to talk about LGBT specific support, such as the suicide prevention resources on the left. Those include hotlines that LGBT people can call, and they can talk with people who are experienced and knowledgeable on LGBT issues, who can help them. And you can hit next. And so in conclusion, the disparate health outcomes affecting lesbian, gay, bisexual, and transgender individuals do not have one singular cause, rather they are a result of complex issues such as intersectional oppression, stigma, and a lack of education regarding LGBT identities. It is crucial that this topic be researched further and that adequate solutions be implemented so as to mitigate these disparities and form a more equitable healthcare system. Many thanks to my mentor, as well as to the officers of the Talaria program. I really had a good time doing my project, and it was a very eye-opening experience.